researches have been conducted. I will just share a PowerPoint. Maybe that can be of interest to you also and to all the other listeners, and see if homeopathy has a standing and a role to play. So I will just try and get my documents to share.
In the meantime, I will request if there are any questions, they can just send in the chat box. अगर आपके पास कोई प्रश्न है तो चैट बॉक्स में टाइप करके आप कृपया लिख दीजिए. और सर हमारे साथ डॉक्टर्स भी जुड़े हुए हैं, अगर उनके भी कोई प्रश्न है तो वो भी अपने प्रश्न चैट बॉक्स में लिख सकते हैं.
Yes, so if any question, we are happy to take. And here I have this presentation. So I was just going through if there was some experience, earlier experience that was shared. So this is a paper that is published on homeopathic management of acute encephalitic syndrome, Dr. Devesh Kumar Devanshu and Dr. Upansha Kumari. Both these authors have shared, in fact, they have collected the studies that were done on acute encephalitic syndrome, and which I will share, and in a very interesting publication. This is from the International Journal of Homeopathic Sciences, and this was published in 2020, volume number 4. I think they are page number 275 or so. And this article is available on the internet, and I will share the link in the chat box for those who are interested. And I will put up the actual results of this study. Just 1 minute. Okay. Yes, so this is the author, the Central Council of Research in Homeopathy with School of Tropical Medicine in Kolkata, 2007 to 2010. They had done a preclinical in vivo and in vitro study on mice, and they found that giving belladonna 200, yes, if that's the potency, if I'm not mistaken, protected the mice from JE infection. That JE stands for Japanese encephalitis, which is another virus that causes this kind of an encephalitic syndrome. And again, CCRH has taken up a study in King George's Medical University at Lucknow, and that study is from March 215, sorry, not 225, 215, which is an ongoing study. Again, it is a preclinical study, and they are trying to understand the action of Calcarea carp tuberculinum as a combined regime in, again, Japanese encephalitis. And as you see, UP, Bihar, they have this, they are quite endemic for this kind of encephalitic illnesses, especially Japanese encephalitis. In 19, there are 3 years where a preventive study was done in these endemic zones of 3,22,812 people in 96 villages in UP. Again, belladonna 200 was given as a single preventive dose, out of which 39,250 people were followed, and none of them had developed Japanese encephalitis, while this disease was very, very prevalent in that geographic zone. Another publication from Andhra Pradesh government, where belladonna was given in day 1 single dose, day 2 and day 3. Then day 10, Calcarea carp 200 was given on day 10. And on the 25th day, tuberculinum 10M was given. All this regime was given to children from 0 to 15 years of age for 3 consecutive years. Again, remember, this is a very high endemic zone where this study was done. And for 3 consecutive years, 99, 2000 and 2001. And then it was found that in the year 2000, 2,000 cases were registered of JE and only 72 deaths. In 2001, only 30 cases were there, and out of which 4 deaths were found. In 2002, only 18 cases were found with no deaths, and in 2003 and 4, there were no reports of JE infection at all. So this showed the impact of the preventive treatment in these acute encephalitic syndrome. One of the reasons, like I said, was Japanese encephalitis. So the question remains, can we draw a parallel for a Chandipur virus? Because like we said, that this also is a virus that affects the brain like the Japanese encephalitis. Then comes the actual treatment where the disease was already diagnosed, and we have this here, where in Central Council of Research with BRD Medical College, Gorakhpur, again UP, where total of 151 kids with acute encephalitic syndrome. They were divided into 2 groups. 121 children was given standard care, and 30 children were given homeopathy as an add-on to standard care. What we found that in the control group, that means homeopathy and the standardized treatment, only 9.9% deaths were found, whereas in the standard care group, out of 121 children, 13 deaths were found, which was 43% was there. There was a 33% in reduction of death rate. And then with the same, because of the same study, they were encouraged to do it on a more larger scale. And what we found in CCRH did it a randomized controlled trial, a total of 612 children, 306 were given standardized care with add-on homeopathy, and another 306 standardized care with placebo. We found 16% reduction in death and disability in homeopathy with standardized care compared to a placebo control, where the control had standardized care with placebo. And the remedies that came through were belladonna, stramonium, arsenic, helleborus, bryonia, sulfur, cuprum, opium, nux vomica. There were quite a bouquet of remedies that we had to treat these patients, and I believe that if we can extrapolate these results to the Chandipur virus, which also is an acute encephalitic syndrome, I believe that homeopathy may stand a chance, would have a possible chance. But of course, experience need to be taken. This could be our basis to take the further experiences. So this is what I had to share about what homeopathy has done in the past and what the studies are going on currently.